Today, the subcommittee is meeting to consider a discussion draft of the Restoring Accountability in the Indian Health Service Act of 2023. This legislation aims to provide tools so the agency can recruit and retain the very best people. The bill would do this by aligning IHS's pay system with the Veterans Administration's, providing better and slightly expanded benefits for healthcare workers, direct hire authority, improving data collection on patient care, among other reforms. The legislation would streamline processes to get rid of unqualified and even predatory staff in an efficient way that protects patients and improves care. The bill would also confirm whistleblower protections that protect those who bring issues to the attention of the IHS, the Department of Health and Human Services, and Congress. The bill also includes several required reports on the reforms that would be instituted to make sure they work as Congress intended. It is a goal of this hearing to discuss what provisions of this draft bill are still needed and what changes and other improvements to IHS can be included. The IHS has long been plagued with issues of substandard medical care, high staff vacancy rates, aging facilities and equipment, and unqualified or predatory healthcare staff. Many of these issues first came to national attention in 2010 when the Senate Committee on Indian Affairs held a hearing and completed subsequent investigation on the issues surrounding IHS of the Great Plains area, showing in detail the extreme deficiencies across IHS direct service health units. The agency has self-identified that its inability to attract and retain quality employees has a domino effect on the quality of care they provide. It is disheartening and frustrating to think about how long these issues have continued. In 2015, further issues came to light in the Great Plains area, resulting in the termination of CMS contracts, the closure of an emergency department, and the deaths of 9 patients. And in fiscal year 2021, the Portland area reported 100% of their dentist positions were vacant. Vacancies are not the only issue. Issues of hiring subpar candidates and lengthy hiring timelines and lower tier benefits that have also factored into the issues of staffing IHS facilities. One doctor was hired in an IHS facility in the Southwest without consideration of all medical licenses, ignoring disciplinary marks she had received in other states. Another doctor, who was unable to find work in other Southwest area hospitals, was hired at IHS after 5 malpractice settlements in 5 years. These are two grievous examples that highlight the policy changes that need to be made. While IHS does have authority to improve some of these issues on its own, statutory efforts is the most certain way to provide stronger guidelines and require oversight. This draft legislation works towards this goal and has the two-pronged approach of also including more incentives for medical professionals to come work at IHS for the betterment of the served communities. We must do better for our American Indians and Alaska Natives. This conversation and this discussion draft is a start. We've now had several hearings dealing with the IHS and our ability or inability to provide adequate medical and dental services to our Native people in the United States. We've had several women who have come to testify and provided extensive information and detail about what they have encountered for their tribes, for their tribal members. And it is just simply unacceptable. We need to fix this, and I am hoping that this is an excellent step in that direction. There are many aspects of the IHS and Native healthcare that can be improved, and I hope this hearing pushes those conversations forward. First of all, Mr. Spoonhunter, you were speaking my language in your testimony when you talked about the challenges associated with the overregulation that comes from the IHS. What I would like to do, because I would think that it might take us 6 or 7 hours if I were to ask you all of the regulations that create problems for you, I'd like to have an opportunity to engage with you since I represent the state of Wyoming, where you can perhaps identify for us, and we'll send some written questions to this effect, that maybe you can identify some of those regulations that cause the largest challenges, maybe for one or two of your facilities, maybe for all of your facilities. But I am a strong advocate, number one, in making sure that you have the autonomy to do what you need to do to take care of your tribal members, because I think you're going to be better at it than anybody out of Washington, D.C. I'm not trying to disparage anyone. I'm just saying you care about the people there more than anyone here ever will, and it is just the reality. The closer you are to this situation, the more effective you're going to be. So I'd like to identify some of those rules and regulations coming out of IHS or HHS or wherever it may be coming from that are causing the challenges that you have, and let's see if we can fix some of those as well. In your testimony, Mr. Spoonhunter, you stated that the NIHB looks forward to working with tribal nations and the committee to think of creative ways to recruit and retain medical professionals in a timely and efficient manner. I would also throw in there perhaps dental professionals, because that's one of the other issues that has been brought to us repeatedly, is the challenges of finding dental care for our tribal members. And so the question I have for you is, could you please expand on what those creative ways could be and how they could align with the goals of the IHS staff recruitment and retention related to this particular draft legislation?
Thank you, Chairwoman. On the staffing levels that IHS has had a problem with filling, again, yes, underfunding positions is a problem within IHS. We all know that, but that's just would be a Band-Aid fix. We really need to sit down with self-governance. We were able to, at Wind River, to get a person that would recruit our physicians, providers, nurses, and vet them through a very rigorous process. And we were able to also offer, through the self-governance and through third-party billing, offer housing. As you know, in my area, Billings area that I represent, Fort Peck cannot keep a doctor because there is no housing there. So, and I know this bill covers a housing voucher in a similar way, but we're able to also bring on a sign-in bonus for providers and through the third-party billing. But again, it's a lot of bureaucracy that IHS has to go through to hire. It takes a whole process. I mean, we were talking today about an administrator that position in one of the IHS service units that they had to raise the wage in order to hire someone to meet the qualifications of that job. And now that job has to wait 90 days because of IHS rules. That's an example of the bureaucracy that we have to wade through in order to hire someone of that administrative magnitude that will help direct these facilities. And so, again, it's a matter of allowing the tribes to come in and be part of that process and asking IHS these necessary questions that Congress, I'm sure that you have asked IHS. Why does it take you so long to hire someone? Why are you not able to recruit and keep someone in that position? Those things are very critical. And you talk about the dentist program. We are all scrambling to try to find dentists and retain dentists throughout Indian country and out, and I know IHS is doing the same thing. But what can we do on a creative side that some of the self-governance 638 programs have done to recruit dentists? Well, let's look at their plans and what they did because as tribes, we are resourceful. We are resourceful because we take what we have and we make it work. And I think that the plans, and like my colleague here, Ms. Church, said, that IHS sit down at the table with the tribal leaders and learn from us. We've taken self-governance 638, and we've done it better than what IHS could ever do.
Okay, I appreciate that, and we want to learn from you. Ms. Marchand and Ms. Church, I would request the same thing. If you've got ideas of how we can streamline this and address it, one of the things in Wyoming, because we are the least populated state in the nation and we only have one university and we don't provide either dental training or medical training. And so we have arrangements with other universities. We send our physicians to the University of Washington, UW, another UW, for example, and then we do the same thing with dental care. And then they come back to Wyoming and must spend a minimum of 5 years, I believe it is, practicing in the state of Wyoming, but they can get in-state tuition when they're going out of state to be able to receive that training. I don't know if those are the kinds of programs that we could do with our tribal members as well, but I'm absolutely willing to look at any innovative ways to address this issue. I know Mr. Johnson is. I'm extremely proud to have him with us on the committee today for the hearing to talk about these things. We do have to leave and go vote, so what I'm going to say is that I really want to thank all of you for being here. I wish we could have spent a bit more time together. It's kind of a strange time for all of us. You've provided extremely valuable testimony. We are going to follow up with you because we do have additional questions.